Yes, you're very most welcome, our viewers of Manuele channel. Yes, today we are going to look at hypertension, right? We are going to look at hypertension, and hypertension is what we call high pressure. Okay, high pressure disease is one of the most common problems that we face in life and is everywhere worldwide. It's not say that it's only in Africa or only in Europe or only in Asia, but hypertension is a common cause, and hypertension is everywhere almost. But today we are going to look at the few signs of hypertension, and at the same time we are going to look at how we can our lifestyle, okay, our lifestyle in case you're diagnosed with hypertension. What should you do, what should you not do? And if you have anybody who is maybe diagnosed with hypertension as well, you can advise him, or you can send him, you can forward him this video. Well, one, how do you know that you have hypertension? Okay, before you go for medical checkup, there are these warning signs, or there are signs that you will see and you will know that I think maybe things are not so good, right? And the first sign is palpitation, palpitations. Okay, what's palpitation? Palpitation. This is a situation whereby your heart is pumping faster. It pumps faster than normal. Okay, you find that your heart is okay. So that's what we call high palpitation. And at the same time, when you check a radial pulse or the temporal pulse, we have the veins passing over here. So when you touch over here like this, you will feel as well there is faster pumping rate. And the times when you're sleeping, when you're in a silent place, you can feel your heartbeat and it is well pumping faster. Okay, so that's the first sign of pressure or hypertension, and you'll find that all patients of hypertension do have that. Okay, then another sign that you can notice is dizziness. Okay, oftenly you get dizzy, right? Dizziness is common. And then blood vision, you lose at times. Sometimes you look at things and then they're not that clear. That is also one sign that you can, when you have these signs, at least go and check for pressure. Go and request medical examination on your pressure and find out how is it standing. Okay, and then there is headache. All right, and normally in pressure you will find that there is not a general headache, but you feel it around this area. Okay, you feel it around this area and you feel like there's some hard stuff hitting your head. Boom, 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 boom. It's a kind of headache that you feel in ulcers, right? So if you always feel headache, you have palpitation, your vision is impaired, please rush and check pressure. Okay, yes, those are the signs. Then how do we push on? How do we live when we are diagnosed with pressure? And it's always a healthy habit that you can always do the things, and as well you prevent pressure. Okay, you can do them when you're sick to control it, and you can do it when you're okay, such that you do not contract pressure. And what do we do? One, we shall request everybody to take little salt. Do not eat too much salt in the food that you eat. Okay, excessive salt is not good for your health, right? And two, when like you're going to eat chicken or meat, at least try to roast it fast so that it drains off that excessive fat, okay, to reduce the excessive fat, and then you can eat it, and it will be healthy for your body and your blood vessels, right? Yeah. And another thing that we can do to prevent pressure is eating whole lemon and whole ginger, right? Eat ginger, eat lemon. You know, at times, I told you last time how to eat a lemon. You eat it with all its peeling, all its in what we call the endoderm of it. Those little, they look like pod seeds, hair-like structures. Also eat them. It will help you to fight this pressure. Okay, yeah. Then another thing that you can do to fight pressure or to prevent pressure is doing physicals. Okay, do physical exercise. Make sure that you do not accumulate excess carbohydrates in your body, because excess carbohydrates in the body will be metabolized into fats. Okay, they will become fats, and some will corrode your blood vessels, and in so doing you will develop pressure. So when you get this energy, you get this carbohydrates, utilize it. Do some little push up, do some little jogging, do some little sweating as well. And then exercise as well will help you eliminate the excessive salts in your body, right? When you do exercise, you get rid of the excess salt as well. And then drinking water is also healthy. People have a problem in drinking water, but drinking water helps you to get rid of the excessive salt. Okay, so guys, thank you for watching our video, and continue sharing it, continue watching it. Another thing that we've not talked about is how do we treat pressure. But mostly, ironically, apart from these behavioral habits that we talked about, the rest of the pressure is managed medically, and depends on which grade is it. And there are a number of drugs that we are not going to look at now, because you need to first know your pressure before you think of any drug. These drugs are given according to the grades. So that's enough for today. You're very most welcome, and goodbye.